Then our distinguished guest for today, Dr. Deepika Chauhan and Mr. Vineet Arora from Venkateshwara Hospital, my senior colleagues, and all my friends. I welcome you all here. Very good morning to all of you. And I take this opportunity for today's health camp today. We are delighted to see you all here for this health checkup camp. I'm very happy that you all are taking a proactive step towards prioritizing your well-being. This camp is designed to provide accessible healthcare, allowing you to get a comprehensive assessment of your health status and receive valuable advice from the team of experienced medical professionals from Venkateshwara Hospital, Dwarka. We encourage you to make the most of this opportunity to learn about preventive measures, address any concerns that you may have, and take charge of your health. Let's work together to build a healthier community, one checkup at a time. This health checkup camp includes an awareness talk on cancer by Dr. Deepika Chauhan, a general health checkup and gynecological consultation, and various tests such as blood pressure, random blood sugar, BMI, BMD, and ECG, etc. Now let me introduce our distinguished speaker for today's talk, Dr. Deepika Chauhan. She is a senior consultant and unit head of radiation oncology at Venkateshwara Hospital. She is a well-known radiation oncologist in India. She has an experience of over 17 years in this field. She has worked in various reputed hospitals in Delhi and Bangalore with latest and state-of-the-art technology in radiation oncology. Dr. Deepika Chauhan is an academician at heart and has various publications in oncology and is an avid speaker at national and international conferences. On behalf of UGC, we heartily welcome you here for today's talk. Now, I would request Honorable Chairman UGC to say a few words to formally begin the event. Thanks.
Can you switch up that? ICMR data shows that in 2023, nearly 1.4 million cancer cases were reported. And worldwide, in 2022, nearly 20 million cancer cases were reported. And almost 9 million of them led to death. And it is projected that by 2050, worldwide, there will be about 35 million cancer cases. So it's a huge public health concern for all of us. But many of us, what we don't know is that cancer is preventable if we take certain measures. And many forms of cancer can also be cured if you detect it early. But to achieve this goal, to prevent it and to cure it, a lot of awareness has to be created. And today, Dr. Deepika Chauhan will talk to us about various aspects of cancer and its diagnosis, how we can prevent it from being victims of cancer. But as I often tell you, colleagues, that from your perspective, the most expensive real estate is your own body. You need to protect it by engaging in regular physical activity throughout the day. It's not that you will go to gym and do some 1 hour exercise and then the rest of the day you will lead a sedentary life. That will not help. You should remain physically active throughout the day. Of course, you need to do exercise at least for 30 minutes, if possible, up to 1 hour. And also the kind of food that you take. And you recollect, often I discuss with you about the importance of taking balanced food, low carbohydrate, high fiber, eating minimally processed food, doing good exercise, sleeping well. These are all simple things that we can adopt in our life, and which will help us in becoming a victim of various kinds of illnesses, not just only cancer. So let us pledge ourselves that we will lead a balanced life and remain physically and mentally healthy. Let me again extend a warm welcome to Dr. Deepika Chauhan, and this program is being live streamed on our UGC social media platforms. Anybody can watch this program and benefit from this program. Dr. Deepika Chauhan.
Okay. Very good morning, all of you. So at the onset, I would like to thank UGC, Chairman Sir, and all of you for having me here. In 2024, India has been declared as World Cancer Capital by WHO. So that means the maximum number of cases, cancer cases of the world are in India. So that means for this, I would like to appreciate all of you for having this vision, to have this vision to detect and to conduct this awareness program here. And I would also like to appreciate your sense of time. So I generally keep attending these kind of programs. And this is the first time I'm seeing that everybody is gathered at accurate time. So it is really, really appreciated. So without wasting my time, let's start the talk. So see, this is not a lecture given by me. You all are, I would be really happy if all of you interact and ask me. You can stop me in between or later, whatever suits. So what is cancer? Okay. So in simple term, it is uncontrollable division of cells. Now, see, normally what happens, the cell divides, each cell divide, and then the cell division continues. Sometimes there is a cell damage that can be detected by body and it can be corrected, or if it is not correctable, that cell is killed and it can be removed from the system. But in case of cancer, these defective cells, they keep on multiplying and then they accumulate in the form of a tumor, which is cancerous, which is cancer, and this cell growth is uh, cancerous growth. So the peculiar feature of this cell growth is that this will keep on dividing at the same place, and sometimes it can spread to other part of the body as well. There are many different types of cancer of all the organs, whatever is there in our body. So the best thing would be to detect these cancerous cells early in their growth. So they give signals which we have to, which we should be knowing, and then we should visit to our oncologist or for that matter, any doctor. Now the data, the number has already been given by sir, so he had made my job easy. Here, one more important point is, see, it is around 23 lakhs in US, out of which the number of death is only to the tune of, so this is the number of death, 6 lakh 5,761. If you see the data of India, out of 14 lakh, the number of death is more than half. That is 9,16,827 to be precise. Of course, this is an old data. This is Global Cancer Observatory, so they keep on, updating it. So this is the latest what we have available of 2022. So you can see what is the reason that we are having so many numbers of death. So it is because here we are detecting it at a later stage. So the chances of, getting cured from the cancer, and if there is a death due to cancer, depends upon the stage at which we are detecting it. So if we are detecting it early, it is almost, I can say, in stage 1, it is fully curable to the tune of 90 to 95%. But at the same time, if we are detecting the same cancer at a later stage, that is stage 3, stage 4, the chances of getting cured decreases drastically. So this is the importance of having a screening program, having an awareness talk, so that we should know what are the signs and symptoms, and we should be vigilant enough to understand the implications of getting it detected in later stage. So that is the whole crust of me being here. So now, of course, the 5 year survival rate has improved. If we talk about past, it used to be somewhere around 50%, and now we are crossing more than 70%. So the common type of cancers: breast, lung, colorectum, prostate, stomach, liver, cervical cancer, and esophagus or food pipe cancer. Other than that, there are other cancers also, brain cancers, which are increasing in India to a rapid with a rapid rate, and then NETs, and sarcomas, bone and soft tissue tumors. So the cancers which causes maximum deaths belong to lung, colorectal, liver, all GIT, then breast, then esophagus, pancreas, and prostate. Now we can see that death from the infectious disease has decreased all over the world, especially in developing countries like India. The infectious disease like tuberculosis have come down because awareness has increased. Now, childhood mortality has also come down. The longevity has increased. It is all-time high in India. But the cancer incidence is rising. What could be the reason? The most common reason is adoption of Western lifestyle. This also, in a nutshell, has been beautifully told by Chairman Sir. So it is the most common factors are smoking. These are also the preventable factors which we can prevent. So smoking, tobacco consumption in any form, be it tobacco chewing or smoking. Even secondhand smoke is dangerous. Then higher consumption of saturated fats, consumption of calorie dense foods. So this has increased like anything. Burger, pizza, all are calorie dense foods. That too simpler carbohydrates which will keep on accumulating. Then sedentary lifestyle. This is also very, very important. In fact, if you ask me which is the most important and most lethal thing here out of these listed, it would be sedentary lifestyle. So these are all the cancer causes. Some are modifiable, some are not. So radiation, that is sometimes it can present as an occupational hazard to the cardiologist, to radiologist, and to my specialty. That we cannot do anything. But other than that, people who are frequently traveling by air, so in them also the exposure to radiation can be there, and sometimes radiation can be given to some tumorous disease or some lymphomas, like in younger age. Then later on this can cause uh, malignancy in of some other body part. Then aging, as we age, the chances of acquiring cancer increases. Pollution. There are many carcinogens which are present in the pollution. There are more than 500 of such carcinogens. Unfortunately, we all are at risk of that. Then the environmental radon gas, it can be present at construction site. This is the most common cause of cancer. Then chronic diseases like COPD, genetics, it is also an important factor because almost 20% of malignant disease cancer is transferable through genes. Then occupation like miners and doctors also. Then asbestos, silicate exposure can also cause cancer. Tobacco, most common cause of preventable cancer. Then smoke, even second-hand smoke is fully capable of causing cancer. Now, there are viruses. So this infection will be viral infection, but it has the potential to cause cancer. So the most common cancer is human papilloma virus. Other than this, hepatitis B virus, hepatitis C virus, Epstein virus. There are many cancer which are carcinogenic, but most common in our Indian scenario is HPV. And the beautiful thing is that HPV is fully preventable. It can be preventable by just taking a shot vaccination, HPV vaccination. Recently, it has been added to the immunization program. So, HPV can cause oral cancer, penile cancer, cancer of the vulva, anal cancer, vaginal cancer, as well as cervical cancer. Now coming to the after HPV, the second thing is tobacco, obviously, and tobacco it can cause many cancers. So in urogenital system, tobacco can cause kidney, ureter, bladder cancer, ovary cancer, and even cervical cancer. Head and neck, all the head and neck cancers like nasal cavity, nasopharynx, oral cavity, salivary gland cancer, oropharynx, hypopharynx, larynx, everything is caused by smoking tobacco. And one more important thing is in head and neck cancer, there is field cancerization. So people who smoke or consume tobacco, they are at risk of developing more than one cancer. This is called as synchronous cancer. It is because of field cancerization. So one patient is having cancer of tongue. He can have cancer of larynx or nasopharynx also. This is prevalent in our practice. We see patient is recovered from one cancer and then at the same time the cancer of second site is being detected. So that is because of the effect known as field cancerization, because the head and neck mucosa is very much susceptible to smoke, tobacco smoke, and it can lead to cancer of all the sites in head and neck. Then we have digestive system, which is at risk of having cancer. Esophagus, the food pipe, stomach, liver, pancreas, colon, then lung and bronchus, obviously, and hematopoietic system. This is also very important. All kind of adult leukemias can be caused by smoking tobacco. So we can see this slide. There are so many types of cancer listed here, and I have told you in addition to this, there can be synchronous cancers also. This all is preventable. It's just that we have to modify our lifestyle and we have to stop smoking. Now, what are the common symptoms of sign? See, the cancer symptoms are variable. It depends which cancer we are dealing with. So, these are some common symptoms which I have listed down. The first is weight loss or loss of appetite. This is a very important symptom. So, whenever unexplained weight loss is there, you should always go and speak to your doctor. Then fatigue, unexplained fatigue. Suppose you are not exhausting yourself and then also you are getting fatigued. That means there's something wrong with the body. Go and meet your oncologist. Unusual bleeding and problem in micturition. That is a sign of, that could be a sign of cancer. Then coughing, persistent cough. Other than infection, the next most common cause is having cancer. Then blood in the sputum. Then difficulty in breathing. The next will be changes in the bowel habits, like chronic constipation or chronic diarrhea. Unexplained lumps and changes in the breast, that is, changes in the shape, size, or symmetry of the breast. Then, if there is any change in the mole, if the size is increasing, I'm sorry. If there is increase in the number of the moles or size in the change in the size of the mole, or if it has started changing its color or the mole has become painful. Now, if the most important thing is how to screen yourself, what we can do about it. So, screening is for healthy individuals, for all of us. So, basically, what is screening? It is the identification of symptoms and sign before the occurrence of actual disease. So, the most important thing is self-examination. Then examination by a trained personnel, which is called as clinical examination, and then some investigations. So these are the cancer wherein screening is beneficial, though we can do it for all types of cancer. But then these are the cancers in which it is documented that these are preventable, as well as these can be detected in the early stage if we enroll ourselves for a regular screening program. So in women, it is breast cancer. So self breast examination, then clinical breast examination and mammography. These three things are enough to detect this breast cancer in early stage. Then we have cervical cancer. In cervical cancer, the self-examination is little difficult. So examination by a doctor and then PAP and HPV test can be done. Then in men, prostate cancer. So for prostate cancer, a simple examination which is called as digital rectal examination is done, and there is a simple blood test which is called as serum PSA, prostate specific antigen, which can be done annually, which would be enough to detect it in early stage. Now, few cancers in which screening is applicable, which can be present in both genders, are colon cancer. It can be the screening can be done by colonoscopy, stool test, or sigmoidoscopy. Then for lung cancer, low dose CT scan is done, and skin cancer, obviously, an examination by microscopic examination by the dermatologist can be done. So, why cancer prevention is so important, why we are talking continuously about it, is because two-thirds of all the cancers can be prevented by avoiding tobacco, avoiding or limiting the alcohol consumption, then eating adequate fruits and vegetables daily. And the definition of adequate is almost at least 3 to 5 servings of fruits and vegetables. Then, knowing family history of cancer, if there is a cancer which is present in our family history, so for that, screening should be done as soon as possible. Then, limiting the exposure to sun and to radiation.
Excuse me, ma'am. This next one. I think sun, limiting sun or radiation is quantified.
Okay, so this is for countries where sunlight is in abundance. It is not applicable to the Western world. Now, whenever we are working in sun, there are some ultraviolet rays which are harmful, which can cause skin cancer. So these ultraviolet rays, the exposure to these ultraviolet rays should be minimal. So when we are exposing ourselves to ultraviolet rays, the chances of getting skin cancer can be there. Then radiation, obviously, like I have explained, all the radiation workers, they are at risk of getting skin cancer.
No, basically, ma'am, most of us are having vitamin D deficiency, so we are less exposed to sunlight.
That is an altogether different
No,
aspect.
many times for that, we sit in the sun. So is there any specific time gap, not more than half an hour, or particularly in place like Delhi? So that's what my
Yeah, so Delhi, it is an entirely different scenario. This I'm talking about all over India, right? So for us, probably the maximum what we can do is the early morning sun we should expose to. I mean, we should go for sun basking whenever it is preferable before 12 p.m. because that time maximum amount of vitamin D will be there. It will the sunlight will stimulate our skin to create vitamin D. But then maximum exposure, like if we are working in sun continuously, that should be avoided. Then if we talk about diet, we should eat a low-fat diet, regular exercise should be there, healthy weight should be maintained throughout life. Now, when I talk about diet, it is not a fancy diet that we should follow. It is about a balanced meal, balanced diet. And in the balanced diet, there is place for each and everything. There's place for sugar, there's place for fat, there's place for protein, place for carbohydrate. In fact, it is not at all divided based on the components. It is divided based on the food we are eating. So, like nowadays, they are saying that protein rich diet should be taken. So, that is not the thing. We should have a well balanced diet. That means carbohydrate should also be there, fat should also be there, and protein should also be there in an appropriate proportion. It is not like you keep on eating protein and just avoid other thing. Then exercise also, it is like sir had explained that it is not just 1 hour of exercise you do and that is enough. So maintaining your need, that is non-exercising activity thermogenesis, is also important. You should regularly exercise, at least for average if you're doing average moderate exercise, then 150 minutes per week should be done. if you're doing heavy exercise, then in that case, at least 70-75 minutes per week should be done. And so this I have explained earlier also. We should avoid tobacco, alcohol, fruit and vegetable consumption should be increased. Obesity, physical activity should increase, and the viruses should be preventable. Now, how we are doing it? So this also I have told earlier. All these cancers can be screened by a simple test which is available throughout. Now, if cancer occurs, then also there is recent development in the cancer treatment. So it is not like cancer is a death sentence. Cancer is treatable. Of course, we are emphasizing the importance of detecting it early, in the early stage, but whenever it is there, at whatever stage it is detected, it is treatable. And nowadays, with the advancement in the cancer treatment, many of our cancer patients are getting treated successfully. So the cancer treatment is in the form of surgery, in the form of radiation, in the form of chemotherapy, immunotherapy, targeted therapy, or hormonal therapy, and also stem cell or bone marrow transplant we are doing in case of leukemias. Now, if it is stage 1 to 2, it is a local disease or early disease of cancer. In stage 3, it is locoregional disease. And stage 4, we have two types. So one stage 4 is locally advanced, and another stage 4 is when it has metastasized to other part of the body. Right? So, for example, in breast cancer, there is a simple lump present in one of the quadrant of breast. This is called as stage 1. If there is lymph node also present, single, then it is stage 2. If there are multiple lumps and multiple lymph nodes, then stage 3, and stage 4 when it has spread to other parts of the body. Now, this is very important. So, this is a common myth that cancer is contagious. Cancer is not at all contagious. The patient having cancer cannot spread it to any other person in the vicinity. But it is important. Sometimes we tell the patient to segregate himself or herself. It is because that the cancer patient with the treatment becomes immunodeficient. So the patient is at risk of getting infection from the normal people. Now, it is not necessary that with cancer, always a hereditary element is present. Sometimes, in fact, most of the times, it can start demo. Then, even after treatment, cancer doesn't stop and it spreads, especially after surgery. This is not true. Once the cancer is detected up to stage 3 disease, if it is resectable, generally it doesn't come back. Then one most important thing is, if we do biopsy, it flares up the cancer. It is not at all like this. Only 0.5% of the cases there can be a flaring up with the biopsy, but then 99.5% times biopsy does not lead to flaring up of cancer. Okay, one more thing is cancer chemotherapy is toxic and it is made up of snake venom. No, it is not like that. It is in the form of a drug which is not poisonous, but then it has some capacity to kill the cells, but it is not venom. Then treatment of the cancer is more painful than cancer itself. This is also not true, though sometimes there can be side effects of cancer treatment, but all those side effects are temporary and they symptoms disappear once treatment is done successfully. And even the side effects are well tolerable, and the sometimes the cancer treatment is absolutely painless.
What I feel is painful, equally painful with the cancer, particularly in case of bone marrow transplant and all. Patient has to go through a lot of pain.
Pain.
Yes, isolation.
So that is because the patient is immunodeficient and he will be at risk of acquiring infections. But as such, cancer treatment is not painful at all. It is painless. So I'm a radiation oncologist. I give radiation to the patient. So patient will not come to know that treatment is happening, right? So likewise, in chemotherapy, the drug is given IV. So when the treatment is going on, patient will not be knowing that something is going on. Though there can be some treatment related side effects, but the treatment is not painful.
Their experience is really
Bone marrow transplant, bone marrow transplant is done only in 5% of the cancer patients. And those 5% also, while taking the treatment, it is not painful. But treatment related side effects are there which make it painful. So it is an absolute myth. It is, yes, yes, yes. No problem.
Ma'am, is there any a test that can
Just 1 minute. Let me finish his question. So, if we eat a lot of barbecued food, that is food which is prepared directly at high temperature, or if we are eating too much of trans fatty acids, so these few things are there which we should avoid. Other than that, direct preparing chapatis on the fire is not at all related to cancer. It will not produce any carcinogen. Yes.
Ma'am, can I ask a question?
Yes, please.
Ma'am, like nowadays, like we get a lot of non-stick cookware. So does that have any effect on the cancerous cells in
See,
the
they say that it is like plastic, Teflon, the coating.
yeah, is
So the way we avoid plastic, it should be avoided. But then there is a major study which was done with microwaves and the non-stick Teflon coating that has not found significant results, significant carcinogens. So
also, ma'am?
if possible, it should be avoided, but then directly there is no evidence that it will cause cancer.
Yes,
Right.
ma'am. Like
So
there
I'll
are
just finish 2 or 3 more slides and then we can take up all the questions.
okay, okay, okay.
So the take-home message is be aware and increase awareness like what we are doing right now. Then quit tobacco, alcohol, improve dietary habits as well as hygiene, regular health checkups, consult your cancer specialist, or for that matter, if direct accessibility to oncologist is not there, ask your family physician. Then even if cancer occurs, then don't fear, give it a tough fight. It is curable. So all these are the problems. So we cannot direct the wind, but we can adjust the sails. Thank you so much. Now the house is open for question. Yes, please.
प्लास्टिक बैग्स में आर्ट कोई भी पूरी आपसे कह देता है वो लेने से ले रहे हैं या फिर बहुत सारे हमारे ऑनलाइन स्विगी जोमेटो प्लेटफॉर्म्स हैं वो प्लास्टिक कंटेनर यूज करते हैं कई बार ये ऐसे देखा गया बहुत सारे सोशल मीडिया प्लेटफॉर्म पे वीडियोस वायरल होते हैं जो एक बहुत बड़े तबके को प्रभावित भी करते हैं और ये सोसाइटी में एक मैसेज आता है कि क्या कुछ स्मार्ट कंटेनर्स में चाहे वो चाय हो या कोई और फूड आइटम हो या फिर पैकेजिंग में यूज किए जाने वाले ऐसे कंटेनर क्या ये काज बन सकते हैं कैंसर की ऐसा कुछ है रियलिटी में या फिर सिर्फ लिखा किया है
नहीं नहीं सर, ये बिल्कुल हो सकता है। देखिए, प्लास्टिक जैसे बॉडी के बाहर काम करता है, मतलब इट इज अ काइंड ऑफ नॉन बायोडिग्रेडेबल मटेरियल। सो माइक्रो प्लास्टिक हैज बीन कैन बी absorbed and it can be there in our system, and later on if the amount is significantly increased, it can affect the DNA, and if DNA is affected, mutation can happen. So what I had shown in my slide previously, so if mutation occurs, that can lead to uncontrollable division of the cells. So but the amount with which it will happen is significantly, so definitely we should avoid. Once in a while it is okay, even that definition of once in a while is not there, but then it how much if you can really prevent it, that would be the best thing to do. जी, excellent. नहीं नहीं सर, वो नॉर्मल एक्सरेज या एमआरआई से नहीं होता है, वो ऑक्यूपेशनल हैजार्ड होता है हम जैसे लोगों के लिए जो कि कांस्टेंट रोज हाई एनर्जी ऑफ रेडिएशन में रहते हैं, या फिर उन लोगों के लिए जो अल्ट्रा वायलेट रेज में हमेशा एक्सपोज रहते हैं, जो बहुत फ्रीक्वेंट ट्रैवलर्स होते हैं, बट उनको भी रेस्ट्रिक्ट किया जाता है। एयरलाइंस में भी ऐसे किया जाता है कि हाई जो पायलट्स एंड ऑल होते हैं उनको एक स्पेसिफिक वर्किंग आवर्स दिए जाते हैं। अनफॉर्चुनेटली हम लोगों के लिए नहीं है ऐसा, बट हम लोग भी अपने टीएलडी बैच वेयर करते हैं जिसमें एक डोज की मॉनिटरिंग की जाती है।
तो ऐसा क्या अभी भी ऐसा कुछ है कि जो हमने वैक्सीन लगवाई है या फिर किसी और तरीके से जो ज्यादा इफेक्टिव कोविड-19 पेशेंट्स रहे हैं वो कैंसरस डिजीज की ओर मतलब कर सकते हैं?
सर अभी तक तो ऐसा कोई डेटा नहीं है, मे बी इन नियर फ्यूचर वी कैन हैव अ लॉन्ग टर्म डेटा। एज ऑफ नाउ वी डू नॉट हैव एनी डेटा विच सपोर्ट दैट कोविड-19 इन्फेक्शन और वैक्सीनेशन कैन बी लिंक्ड टू कैंसर। जी मैम। जी,
कि अगर हम प्रिवेंट करना चाहते हैं उसके लिए वैक्सीन क्या एज स्लॉट्स हम इसमें औरतें ले सकती हैं या फिर बच्चे ले सकते हैं?
नहीं, फीमेल्स भी ले सकती हैं। सो दे से दैट मैक्सिमम benefit is up to the age of 26 years, but then it can be taken up to the age of 45 year with benefit.
45 there is no risk of
No, it is not like that. It cannot, but most of the HPV related cancers are the stain which we are seeing, that is there whenever sexual intercourse is taking place actively. So it will give protection to them only.
Is it better to take the vaccine after?
Yeah, some non-cancerous diseases like papillomas and other things also it can help.
Throw some light on the increased screen time. Is affecting and how system of human being.
Okay, right. So, see, there is, like I said, there is no direct connection between the increased time and occurrence of cancer. See, screen times, more screen time means we are sitting and we are watching. That means it is leading to sedentary lifestyle. We are just sitting and straining our eyes. We are not doing any physical activity. So if it is happening, then probably eventually weight gain will be there, and obesity and physical inactivity indirectly can cause cancer. Okay, right. So we run a regular screening camp in the hospital as well as outside the hospital, like the one which is running upstairs. And other than that, if there is any family history, so proper counseling is done, and all the screening tests can be done at any point of time in the hospital. Suppose if someone is having cancer, then the full treatment of cancer, what I had shown in the slides, there is a surgical team, surgical oncology team. There are in fact many surgical oncology teams at hospital. Then other than that, chemotherapy, targeted therapy and immunotherapy, everything is available. In radiation, we have got latest state of the art machines in which X-ray therapy is given, even stereotaxy and brachytherapy is done. So it is fully loaded with all the recent equipments for cancer treatment.
Why the 50 drugs? Like to recommend some of that on annual basis.
Yes, definitely. For females, regular pap smear test and mammography should be done. Regularly means annually, every year. And for males, PSA and physical examination should be done, digital rectal examination.
Screen time, but other than that, when radiation programs to carry from body or skin here, can be session. Secondly, when you causes you mentioned pollution, but the adulteration of food is also important.
Yes, definitely.
What we can do, like, the consumption of pulses or vegetables, because that's something.
See, I have not covered this part because there is not much what we can do. There should be strict government guidelines. They should limit the use of pesticide and promote the organic farming. But then these are the things which are beyond our control. So what we can do is to go for organic farming, things which are available, which are grown organically, if it is possible, because maximum the most harmful thing which I can say, if I have to pinpoint, other than smoking, will be the use of pesticides and fertilizers, which is way beyond than the acceptable limits which is being used here. So for that we should have a stricter policy, like it is there in the Western world. They have very strict policies.
सांस लेने का मतलब है कि अच्छे से 30 सिगरेट्स स्मोकिंग करने का तो आपने टोबैको का भी मेजर आपने बताया है contributes to your cancer. तो उसमें हम क्या कर सकते हैं? We have to go to office, we have to go to school, and it's like from a baby to a elderly, everybody is.
Exactly. See, there are things which has to be done by the government side. As a community, what we can do is we should maximally use the public transport. We can use mask. We should stay indoor maximum. Outdoor activities should be. That's what. If you ask me, I will tell all this. But then there are things. See, the society should be driven towards maximum avoidance of pollution. But then other than these things, The best thing which we recommend to people who are having constant bronchitis or pollution related illnesses to shift out of Delhi. Recommended guideline, it is not there, but then in experiment we have got many tests. But as per guideline, which is recommended, that test is still not there. So best thing is to go for screening. See, that's why we do screening, and then a proper genetic counseling is given that is based on many factors. So whatever the previous history is there, that we document. Other than that, many other questions will be there pertaining to that risk, that particular cancer. And then we prepare it comes in the form of a calculator. So we take history and calculate the exact risk which is there for you having been that cancer present in your family. जी सर.
ऐसा भी आता है कि खाना खाने से जो सेल्स हैं उसकी मर जाती है. ऐसी कोई वेजिटेबल या कोई ऐसे फ्रूट्स या ऐसे कोई है ताकि वही खा सामने में जाते हैं बहुत लग जाती है इसका और मुश्किल भी हो जाता है. तो इस तरह का कुछ
सर फ्रूट्स एंड वेजिटेबल्स की बात करें तो कोई भी फ्रूट या वेजिटेबल एंटी कैंसर या प्रो कैंसर नहीं होता है. फ्रूट्स एंड वेजिटेबल्स दे प्रोवाइड न्यूट्रिशन, like they provides they are anti-free radical, they give vitamins which are called as protected food protectors. But then anti-cancer property सिर्फ फ्री रेडिकल इफेक्ट जो खत्म होता है फ्रूट से उसकी वजह से है.
ऐसा है कि क्या वो कैंसर को रोक सकता है?
हरिंदर बोल रहा है.
देखिए, अच्छा खाना जरूर खाना चाहिए, है ना. जैसी डाइट उन्होंने बताई वो जरूर लेनी चाहिए. उस कैंसर को किल करता है या नहीं ये अभी भी हमें पता नहीं है. जब कैंसर हो तो कैंसर का ट्रीटमेंट लेना चाहिए. बाकी नॉर्मल फंक्शनल नॉर्मल वेलबींग के लिए अच्छा खाना और जैसे उन्होंने डाइट बताई वो जरूर कर सकते हैं. बट उसमें कितना एंटी कैंसर प्रॉपर्टीज है, सिर्फ उसी से ठीक हुआ ये क्वेश्चनेबल है. Yes, definitely it can cause, because stress create cortisol. Cortisol is the main hormone which is responsible for obesity and so many other cancer related illnesses.
परिवार होना बहुत जरूरी है.
बिल्कुल.
सेग्रीगेशन हो रहा है,
स्ट्रेस कॉज कर रहा है वो. बिल्कुल बिल्कुल. See, the normal cancer treatment for the common illnesses is not that costly, but then there are few things like I have mentioned: transplant, targeted therapies, immunotherapies. They are definitely costly. But the normal thing which we should take, the normal chemotherapy regimen, surgery, and radiation therapy, they are not costly. Mole. Any discoloration of the skin, any pain, any swelling or lump? Biopsy. Yes, yes. The main test would be biopsy. Thank you so much.
I thank Dr. Deepika Chauhan for such informative and interactive talk with us. And now I would request Honorable Vice Chairman UGC to present a memento on behalf of UGC to Dr. Deepika Chauhan. Ma'am.
सभागार में इतने ज्यादा मेडिकल ज्योतिष बैठे हुए हैं। आधे आधे प्रश्न का जवाब तो नहीं दे सकते। एक से एक हम
Amazed by the knowledge and interest you all. It's very, very important. See, the basic building block is lifespan.
इसीलिए इस लोगों का ये लिखा हुआ है कि यूजीसी ज्ञान और विज्ञान से विमुक्ति प्रदान कर देती है। एक से एक तो मैं जाता था ट्रीटमेंट के लिए। बहुत अच्छा बहुत बहुत धन्यवाद।
Now I would request Honorable Vice Chairman UGC, sir. हमारी तरफ से वेंकटेश्वरा हॉस्पिटल को भी हम एक मोमेंटो देना चाहते हैं। I would request Mr. Vineet Arora to please come on the stage.
आप लोग इतना दूर से आए, द्वारका का मैं नाम सुनते ही तो मैं कई जगह मना कर देता हूँ। बहुत दूर थी द्वारका। त्रिपाठी जी हैं हमारे यहाँ, हिम्मत करते हैं। बहुत बहुत धन्यवाद। बहुत अच्छा वेंकटेश्वर हॉस्पिटल 2017 से और 20 के बीच में हमारा जो कार्यकाल था सेक्टर 11 में द्वारका में लाल बहादुर शास्त्री इंस्टीट्यूट ऑफ मैनेजमेंट का मैं डायरेक्टर था। तो सेक्टर 4 में रहता था, तो मैं कई बार कुछ ट्रीटमेंट कराने के लिए गया हूँ। बहुत अच्छा हॉस्पिटल है और वहाँ के डॉक्टर भी बहुत अच्छे।
500 बेडेड हॉस्पिटल, फुल फ्लैश हॉस्पिटल है और भी स्पेशलिटी भी है और सेक्टर 18 में लोकेटेड है। और कोई भी सर के पास मेरा नंबर है।
कोविड के टाइम में आप लोगों ने बड़ा सराहनीय काम किया है, ये मेरे को पता चला था। अच्छा काम किया।
अब हम इस टॉक के फॉर्मल कंक्लूजन पे पहुंच रहे हैं। उससे पहले आई वुड रिक्वेस्ट कि हमारे अपने आशीर्वचनों से वाइस चेयरमैन सर हमें कुछ मार्गदर्शन दें ताकि जी प्लीज। थैंक यू।
डॉक्टर दीपिका चौहान जी ने इतने सरल शब्दों में और सरल तरीके से एक कैंसर का मतलब ही होता है, 12 राशियों में एक राशि कैंसर की है, तो डरते हैं लोग, लेकिन इतने सरल तरीके से उसकी व्याख्या करी है और हमारे अध्यक्ष महोदय ने भी उसकी जो रूपरेखा रखी है, जो मैं समझ पाया हूँ कि फिजिकल एक्सरसाइज करना जितना भी संभव हो, डाइट को कंट्रोल करना और कुछ ऐसी चीज़ें हैं, टोबैको है, खासतौर से मैं देख रहा था टोबैको, अल्कोहल, इन सब से दूर रहना चाहिए। बट पैसिव वे में भी, जैसा दीक्षा जी ने कहा कि पैसिव वे में भी हम लोग को बहुत सारा टोबैको का स्मेल हम लोग लेते हैं, वो भी खतरनाक है। तो स्ट्रेस भी एक बहुत बड़ा फैक्टर है कैंसर के लिए। पूरे विश्व में इसके बारे में अनुसंधान हो रहा है। अभी अखबारों से ही मेरे को सुनने में आया है कि शायद रशिया एक वैक्सीन लाने की कोशिश कर रहा है सितंबर अक्टूबर तक। और जो डेथ की जो कारण है ज़्यादा इंडिया में, वो मुख्य कारण यही है कि हम लोग अल्टरनेटिव थेरेपी में बहुत चले जाते हैं। तब तक वो बहुत ही एडवांस स्टेज में आगे बढ़ जाता है और अल्टरनेटिव थेरेपी में चले जाते हैं। मैं उस पर ज़्यादा नहीं बताऊंगा, लेकिन बहुत सारे यहाँ पर नीम हकीम खतरे जान बैठे हुए हैं, यहाँ पर भी और बाहर भी। तो वो उस सुझाव की वजह से भी कई बार होता है। टाटा मेमोरियल हॉस्पिटल में भी सेल थेरेपी के ऊपर काम हो रहा, और हम लोग को बहुत ही गर्व की बात है कि कालरा जी की जो सुपुत्री हैं वो सेल थेरेपी पर काम कर रही हैं, बधाई के पात्र हैं। तो ये कोई डरने की बात नहीं है, प्रिवेंटिव है, रुक सकता है, लेकिन पता नहीं चल पाता। इसकी खास बात यही है कि जहां तक मैं समझ पाया हूँ, प्रिवेंशन तभी हो पाएगा जबकि उसके बारे में जानकारी, और जानकारी थर्ड स्टेज पर ही लोगों को हो रही है। इंडिया में बहुत ज़्यादा टेस्ट और पैथोलॉजी और इसकी परंपरा नहीं रही है, इस वजह से भी हम लोग रेगुलर चेकअप नहीं कराते हैं और इस तरीके के टेस्ट नहीं कराते हैं। वो भी कई बार फैक्टर बनता है। तो मैं समझता हूं कि आज का जो कार्यक्रम हुआ है वेंकटेश्वर हॉस्पिटल की तरफ से, और डॉक्टर दीपिका चौहान ने जिन सरल शब्दों में व्याख्या करी है, आप लोग उसको उस पर विचार करेंगे और अपनी जीवन की रक्षा, अपने परिवार की और समाज के जीवन की रक्षा करेंगे। और ये अवेयरनेस का मतलब है कि केवल आप इस अवेयरनेस को अपने तक ही सीमित ना रखें, और लोगों को भी आगे इसके बारे में बताएं और उनको जानकारी दें, तभी ये बात आगे बढ़ पाएगी। हमारी बहुत शुभकामनाएं। आज शायद कुछ और भी कार्यक्रम है, टेस्ट वगैरह का भी कार्यक्रम है, कुछ शायद वेंकटेश्वर हॉस्पिटल की तरफ से हो रहा है, तो उसमें भी आप पार्टिसिपेट करें, देखें, और हमारी शुभकामनाएं हैं। आरोग्य बहुत ही आवश्यक है, रोग का ना होना बहुत आवश्यक है, और आप सभी लोग स्वस्थ रहें। बहुत तरीके की मिथ्स और भ्रांतियां ये कोविड के वैक्सीन को भी लेकर के, तमाम और चीज़ों को लेकर के हमारे मन में रहती है, तो उसको दूर करने का प्रयास करें और ईश्वर में विश्वास रखें। ये ऑन द रिकॉर्ड नहीं, ऑफ द रिकॉर्ड मैं कह रहा हूँ, कुछ चीजें हम लोग के हाथ में नहीं होती हैं। आप देखेंगे कि ये कुछ चीजें अपने हाथ में नहीं होती हैं, और हमारे ह्यूमन बॉडी में भी इतना जबरदस्त डिफेंस मैकेनिज्म है कि कोई भी अगर बीमारी होती है, कोई भी इन्फेक्शन होता है, तो हमारे शरीर के अंदर ही बहुत सारी एक्टिविटी शुरू हो जाती हैं जो कि उसको समाप्त कर देती हैं। और इम्यून सिस्टम अपना आप अच्छा रखिए, और स्ट्रेस की वजह से इम्यून सिस्टम बहुत कमज़ोर होता है, ये मैं व्यक्तिगत रूप से जानता हूँ। तो स्ट्रेस कम से कम हो, सोशलाइजेशन प्रोसेस रखें, अपनी समस्याओं को दूसरे लोगों को भी बताएं, परिवार के लोगों को बताएं, अपने मित्रों को बताएं। कई बार गलत एनालिसिस की वजह से भी हमारी समस्याएं बढ़ जाती हैं, तो अवेयरनेस रखें। आप सभी लोग स्वस्थ रहें और रोगों से दूर रहें, और लोगों को भी जागृत करें और अवेयर करें। हमारी बहुत बहुत शुभकामनाएं हैं। धन्यवाद।
Now we have reached to a formal conclusion of the event. Now I would like to thank everybody who is present here and who have joined online for being with us for this talk, and I would request everybody to please join us for the health checkup camp. Thank you.